Hello, we're answering questions on sexual health. I'm joined by Dr. Catherine Hood. Hello.
Hello.
Catherine, I've got a question here from somebody who's recently started sleeping with their new boyfriend, but they've found that they've been bleeding after sex. What could be the cause of this?
Okay, I think the most important thing is how old is this person? Age does come into it to some extent. If they're a young person who has not gone through the menopause and is still menstruating, then you have to start looking at common causes like infection, and some people think missed pills, but actually the most common cause of bleeding between your periods actually is infection, a sexually transmitted infection like chlamydia. If you're through the menopause and you're starting to get bleeding after sex, then that could be a problem further up in the uterus, and it's really important you get that checked out by your doctor. So if we're talking about young people here, let's stick with that.
Yes, it seems more likely, I think, in this question.
I think that the most important thing is obviously with a new partner, it's possible to pick up an infection, and there's an awful lot of sexually transmitted infections out there. Chlamydia is the most common bacterial sexually transmitted infection, and this can cause in women, it can inflame the cervix, which is the neck of the womb. And when you have sex, it literally bashes the cervix and you get some bleeding afterwards.
So go along to your GP, get yourself checked out?
Go to GP or local genitourinary medicine clinic and get yourself a checkup.
It's quite a simple test, isn't it, for chlamydia?
It is very simple. I mean, GPs now can do a lot of the tests in their surgery. It might just involve a urine test, although for most women we will also suggest they do a swab. Now that might be something they do themselves, just a quick swab from inside the vagina they can do in the ladies' loo and hand back to the GP. But if you go to a GU clinic or genitourinary medicine clinic, you can have a full checkup where the doctor will actually examine you and have a look at the cervix and see what it's looking like, and just then can give some advice off the back of that. But the other thing to just check is that you're up to date with your smear tests, because obviously any bleeding around sex, it's important that the cervix is just checked to make sure there's no signs of abnormality going on in the cervix.
And it probably goes without saying that any kind of blood from that area, you really must check it out. Don't look at it and think, oh, I'm sure that will go away.
Yeah, don't sit there and think, oh, it'll nothing,
be all right.
It'll be all right, yeah.
Good, go and get it checked out.
Yeah, do make sure.
Thank you, Catherine, for that. Good advice as always. Well, if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.